This is the Best Health Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Hey, thanks for listening and tuning in to the May edition of our Best Health Podcast. We hope that everyone is enjoying the first part of spring and April showers, or should I say January, February, March, and April showers are going to bring May flowers here to our area, and we're very excited to have a special guest with us, Miss Rayetta Johnson, who is a registered nurse and a stroke program manager here at Wake Forest Baptist Health. Welcome, Rayetta.
Welcome. Thank you very much. I'm excited to be here.
How's it going today?
It's going great. It's a beautiful day in Winston-Salem.
That's right. So we're going to talk about a really important topic for May. May's, Stroke Awareness and Prevention Month. So we're going to dive into some key facts and information bullet points about stroke awareness here in a minute. But before we do, just tell us a little bit about yourself. Are you from around here, or how'd you land at Wake Forest Baptist?
I actually came to North Carolina Baptist Hospital School of Nursing from the western part of North Carolina in 1970.
Wow.
So I've been here ever since. It just felt like the place to be, to learn and grow and be the best that you could be in your field. I've always been in neurosurgery and neurology.
Sure.
Presently I am working in the stroke center. We have a tremendous program. We offer the latest and greatest treatments for stroke. We're very involved with stroke prevention, and as well as emergency treatments. We have one of the most dynamic treatments available now at Wake Forest Baptist, where it's called a thrombectomy procedure. That previously we've only been able to treat patients 3 to 4.5 hours with a medicine called clotbuster. It's called TPA. But that treatment window has expanded up to 24 hours that we can help people now. We can only help people like between that 3 and a 4.5 hour window from onset of symptoms. But now we can treat people up to 24 hours, which is tremendous.
Yeah, speaking of growing, and if you've been here since 1970, I can imagine you've seen not only physical growth, but just the advances in technology over the last few decades. That's pretty incredible.
Absolutely.
So we're going to get into some of that here in a minute, which is some of it's just really interesting and fascinating to learn about how far we've come in stroke treatment. But let's just start kind of, I guess, at a baseline. There's a wide range of people listening to our Best Health podcast. And so just, I guess, talk about real quickly, what is a stroke? How does a stroke affect our body? What happens in our body when someone's having a stroke?
Okay, Justin, that's a great question, actually. Stroke affects the brain. Sometimes we call it a brain attack, because most people are familiar with heart attacks and symptoms of a heart attack. So we like to compare a stroke as a brain attack, and that it's an emergency. People need to realize they're having a stroke immediately and get to the emergency room. So a stroke is basically just a blockage of blood flow. There's a blood clot that gets trapped in a blood vessel and doesn't allow blood to flow anymore, so that can cause a stroke. 85% of strokes are caused by blood clots or blockage of an artery in the brain.
Gotcha.
The other 15% of strokes are caused by hemorrhage, like someone might have a little weak spot in the vessel of their brain blood vessel, and all of a sudden that little weak spot will just kind of rupture, and you will have this massive hemorrhaging in your brain. Okay. So that's called a hemorrhagic stroke.
Okay, gotcha. So in preparing for the podcast, I was interested to look at some of the statistics in our country for how prevalent stroke is. So if I'm not mistaken, it's the 5th leading cause of death in the United States?
It is.
So we have millions of people who suffer each year in America?
We do. About 800,000 people every year.
800,000, okay.
Yes, suffer from a stroke. And it is, like you said, Justin, it's the 5th cause of death in the United States, but it's the 1st cause of disability.
Gotcha.
in the United States. So stroke is more of a disabler,
Yes,
if you will,
yes.
than a killer, kind of.
Sure.
So it causes people to be paralyzed, unable to speak, possibly. And if they do not receive emergency treatments that we have available, then they may be, totally disabled for the rest of their life. So that's why it's so important, especially now that we have all these great treatments available that we didn't used to years ago, for everyone to understand the basic symptoms of a stroke, to identify them, call 911 immediately, and get to the nearest emergency room.
I'm glad you brought that up. So that leads into a great acronym that we've been trying to get the word out about, FAST.
Yes.
Not talking about me and my 40-yard dash speed. It's an acronym that we use here in the medical arena. So FAST is a great little nugget that people can remember. So walk us through what FAST is and how people can remember that.
Okay, great, Justin. That's exactly right. That's so easy, I think, for people to remember. So in the FAST acronym, F is for face. So you would, if you were talking to someone and they seemed, to all of a sudden change, and you thought they might be having a stroke, you would ask them to smile. Just ask them to smile. And then one side of their mouth would not be able to go up into a smile, so they kind of have a crooked smile.
Gotcha.
Okay? A is for arms. So you'd ask the person to raise their arms out, and if they may be totally unable to raise the affected arm, or the weak arm would just kind of drift down, fall down. And then S is for speech. You would ask the person to say a simple sentence like, "It's a beautiful day in Winston-Salem,"
Sure.
for instance. And if their speech was affected by the stroke, their speech may be very garbled and mumbled, and you couldn't even understand the person.
Gotcha.
And then T in FAST is for time, meaning every minute counts when you're having a stroke. Actually, 1.9 million brain cells die every minute after a stroke occurs.
1.9 million per minute.
Yes.
Wow.
That's a lot.
So that T in FAST is important, the time.
Exactly, Justin. That's perfect. Yes, that's why it's so important that the person identifies they're having a stroke, calls 911 immediately, and then EMS has been trained. We have done a lot of classes with EMSs in our region. So they know how to start immediately treating that patient. They'll actually call us en route with the patient to the hospital. So we actually run down to the emergency room. We're waiting at the back door as soon as the patient arrives, because we're also trying to save every minute. So we're right there, waiting for the patient. We'll zap them quickly down the hallway to the CT scanner, because that's the first diagnostic test you have to do for the stroke patient.
Okay, that's good info.
And then we want to basically rule out a bleeding hemorrhage. But if the stroke is caused by a blood clot, which 85% of strokes are caused by blood clots, so the majority of strokes are ischemic or obstructive strokes.
Okay.
Then there's a lot we can do for it emergently for that patient. So we can, like I mentioned, we can give the clot busting medicine within 3 to 4.5 hours after onset of symptoms, and then we can also now do the wonderful procedure called a thrombectomy.
Yeah, you mentioned that earlier. So talk a minute about the thrombectomy.
Sure.
And just how really amazing that procedure is, and kind of what happens, and how quickly a patient can respond to a thrombectomy becoming successful.
Okay, sure, yeah, that's great. I love to talk about that procedure because we've seen such amazing results with it.
Yeah.
So if the patient gets here in time, of course, within that 24-hour time frame, and the patient has significant deficits, we'll call, like paralysis on one side, or inability to speak, or inability to see. And then we do the CT scan, like I mentioned, and it does show that the patient has a big obstruction in a large blood vessel in the brain that we can do this procedure for. Then we'll immediately take them up to radiology, where we do the procedure. It's not surgery, it's just x-ray, it's just radiology. It's a special radiology suite.
Okay.
So the patient just goes into that suite. Everybody, we have a system where we call everybody. Everybody's on call for this. So, like, we have emergency recall. So everybody gets here very quickly.
Yep.
And so we start immediately preparing, and the patient will go into the suite. They probably will not have anesthesia. Sometimes may, depending on the specific situation. But a lot of times we can just kind of give a little, relaxing medicine, if you will.
Sure.
And then, of course, just some numbing medicine. We'll just kind of put a little catheter into a blood vessel, either in the groin area, the femoral artery in the groin, or now actually we're doing another procedure where we can just do an artery in the wrist.
Wow.
Which is pretty amazing.
It
also,
is,
actually, yes. Dr. Stacy Wolf, one of our neurosurgeon and neurovascular surgeons, actually has started doing that procedure, which is really phenomenal to be able to do that procedure.
That's pretty cool.
So you just thread the catheter up into the brain under fluoroscopy. This special dye that the surgeon can track the catheter going through all the blood vessels all the way up to the brain.
Sure.
And then you can see where the blood vessel in the brain's totally blocked off. It's not allowing any blood any further than the blood clot. So the catheter just threads up through that little blood vessel, and then when it reaches the blood clot, it will kind of emit a little wire cage, if you will, that totally envelops the blood clot, and then you just drag the blood clot out.
That's amazing.
It is totally amazing. And this patient, okay, say I just remember a patient just yesterday, okay, that came in that had an occlusion or blockage of blood flow on the left side of their brain. So they had right-sided weakness and inability to move, their right arm, their right leg.
Okay.
Also was unable to speak, okay? So Dr. Wolf was able to grab a hold of that blood clot and drag it out, like I said, renewed the blood supply to the brain. That person actually reached up with what was previously their paralyzed arm and, like, tapped her on the shoulder. I mean, like,
just
and
right there in the room.
Right there in the room, right. So it's dramatic.
Wow.
It's dramatic results. It's pretty amazing. So, if that patient had not recognized they were having a stroke and had not called 911 immediately, gotten to the emergency room very quickly, then maybe the results wouldn't have not been so great,
Sure.
But so I can't impress the importance of everyone in the community recognizing the symptoms of stroke, calling 911 immediately, and getting to the emergency room. That is just major.
Yeah, that's a great story. Thanks for sharing. So we've talked about a couple different pieces of our comprehensive stroke program here. We talked about the medicine, the medical part, the surgical piece. But for some people who suffer a stroke, they have to participate in rehabilitation.
Yes.
So would you mind talking just briefly about the stroke rehabilitation program that we have here at Wake Forest
Sure.
Baptist and how patients can progress through that?
Mm-hmm. Yeah, absolutely. So after the patient receives all the treatments we have available and that they are eligible for, and then they kind of go through that, what we call the acute phase of medical treatment after a stroke in the hospital. Then if they still have some difficulties with movement or speech problems or vision problems or mobility issues, if they have any deficits at all, they may be a candidate to go to rehabilitation for a little while. And we have a wonderful rehab unit. It is called the Stick Center.
Yes.
And so patients may go over to our Stick Center for rehabilitation, where they get intensive therapies like physical therapy, occupational therapies, speech therapy. It's a wonderful program to really help people continue to get better. So if they're not completely better, then they can go to rehabilitation to continue to recover and get better, and hopefully reach their maximum ability to perform normal daily activities.
Sure. So our therapists over there work with them and follow them kind of the continuum of progression they make.
Yes.
And,
exactly. They'll get 3 hours of therapy every day.
Every day, okay.
Yes, so it's very intensive therapies.
But it shows positive results.
It does. And I would just like to interject also, even after rehabilitation and the patient goes home, they can continue to recover, though, after a stroke. So that's real important, I think, because we used to think that you didn't recover maybe a lot after just a few weeks or months after a stroke, but you can actually continue to recover up to 2 years or even beyond that. So, I mean, that's wonderful. So I think that gives all stroke patients hope, that, okay, this is it. I'll never get any better. But you can get better after even a few weeks. So that's an important piece, I think.
Sure. I did have another question, too. And, are people, they might just think that my risk for stroke is what it is. I'm genetically prone to have a stroke or I'm not. Mm-hmm. So I'm either going to have a stroke or I'm not. So talk about who's at risk maybe for a minute, and then what things we can do, some things that we as humans do to increase our risk sometimes.
Right.
But then stuff that we can do to reduce our risk of stroke.
Mm-hmm. Okay, that's great. I love that because at Wake Forest Baptist, we also would truly just like to prevent strokes. We just want to go out of business and not have any strokes happen. So the number one cause of strokes is hypertension, high blood pressure.
High blood
pressure is the number one cause of strokes. So we absolutely encourage everyone to know their blood pressure, right? What their blood pressure is, and a lot of people really don't know what their blood pressure is. Maybe they don't go to the doctor.
I've heard that a time or two.
Right. So, but it's really important to know what your blood pressure is. So, and now the American Heart Association says that our blood pressure should be around 120, top number 120 over 80. So 120 over 80 is our target blood pressure, if you will. It used to be just a few years ago, it used to be 140 over 90, but the Heart Association kind of keeps creeping down. So really the optimal blood pressure, if you will, is around 120 over 80. That's kind of our goal. But everyone's different. You have to look, at everyone individually.
Sure.
So the physician may not suggest that's your best blood pressure, but just, generally we'll go with what the Heart Association says that.
Sure.
Our goal is 120 over 80.
Sure. So what can we do to help keep our blood pressure in check if that's the number one risk factor?
That's a great question. So we need, number one, to know what it is. Of course, with just everything, it's healthy living, if you will. So healthy diet, low cholesterol, low fat diet. And also exercise. Like the Heart Association suggests that we exercise at least 3 times a week for 30 minutes a day. So that 30 minutes a day doesn't have to be all at one time. It could be, 10 minutes in the morning, 10 minutes at noon, 10 minutes in the evening, however you want to do it. Yeah. But so that's kind of the recommendation by the American Heart Association, 30 minutes a day. But and probably I like to say that, the cheapest, easiest exercise is just walking, just walking.
Walk around your neighborhood.
Yeah, walk around your neighborhood. Walk around the mall even, if it's a rainy day or whatever. But just walk. You don't have to go to a special gym just to exercise. You can just walk, basically. Other fun exercises are like swimming. Dancing is even good exercise.
There you go.
So, make it fun. I think it's fun to mix it up.
Do a little Zumba.
Yeah, do a little Zumba, yeah.
Well, that's good. That's good information for helping keep our blood pressure in check. And probably the disclaimer, too, of no smoking.
Yes, absolutely.
So,
absolutely, good suggestion. Yes, because smoking is one of the risks for having a stroke. Smoking, excessive alcohol use, illicit drug use. We see some young people come in that have been utilizing, meth, say, for instance, cocaine, or some of the street drugs, I guess you would call them out there, and they can have massive hemorrhagic strokes, that other kind of stroke that we didn't talk about a lot yet, but the hemorrhaging kind of strokes.
Gotcha.
So, and that's really devastating because those people can be very, very sick and sometimes do not recover well.
Sure.
Sure,
so staying as healthy as you can.
That's right. Stay, healthy, everything in moderation, if you will, I think, moderation in eating and drinking and also exercising, not sitting on the couch and watching TV all day is not good for us. We need to stay active.
Now the gyms have all the flat screens at the gym. We can watch
That's
TV
right.
when we're on the treadmill or
That's right.
on the elliptical.
That's great, Justin. Yeah, so I guess you can watch TV then, but just so you're moving, right?
I've seen them at the gym. I guess I need to use them.
Good suggestion.
So we just got a couple minutes left. We actually have a neat tool on our website, on the Best Health website. If people go to wakehealth.edu/besthealth, they can take the stroke risk assessment, and that's just a quick quiz, if you will. It just takes a few minutes, about 5 minutes to complete, and that can give someone just some initial baseline information about whether maybe they should seek some additional consultation from their primary care physician or another physician. They can always call 716-WAKE if they're want to know their numbers or think they might be at risk for a stroke. So I just want to throw that plug in there for our stroke risk assessment because it's a great tool for people just to initially find out where they might lie on the field of risk or not.
Absolutely.
So just real quick, I did want to mention, so we have a lot of really hardworking providers like yourself that are out helping take care of patients. And this past year, we were actually ranked, our neurology and neurosurgery were ranked by U.S. News and World Report. Is that correct?
That's correct. We were, highly ranked in that report. So that's tremendous. That gives us kudos, if you will, for our great program that we do have. We have 7 stroke neurologists.
Okay.
And also we have 3 neurosurgeons that are vascularly trained. Mm-hmm. We have 3 neurointerventionalists in our program. And then as well as our rehab physician specialists. So, so we have a lot of great physicians. We have a lot of nurse practitioners, physician assistants.
Sure. So it's a pretty comprehensive team.
It is.
Here.
It is. Actually, we are a comprehensive stroke center, which is a huge deal. That means that we are the best of the best of stroke centers in the country. So that's really important. So we are, Joint Commission certified comprehensive stroke center.
Yeah, that's great. Thank you for pointing that out as well. So we're about to wrap up. I just want to once again thank everyone for listening to our May edition of the Best Health podcast, and thank you, Rayetta, for joining us. So much good information. And May is Stroke Prevention Month, so we do encourage everyone to check their numbers, know their blood pressure, and take the stroke risk assessment at wakehealth.edu/besthealth. And people can, like I said earlier, 716-WAKE, call, make an appointment, and we'd love to talk with you further. So hope you all have a great May. Hope you get outdoors and get a little bit of exercise and sunshine. And we'll talk to you soon. This is Justin Gomez signing off from Wake Forest Baptist Health.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu and follow us on social media. Wake Forest Baptist Health, the gold standard of healthcare.